A recent study from the University of Georgia College of Pharmacy highlights the lack of access to Alzheimer's disease treatment for rural Georgians. 41 NBC's Taylor Gilchrist has more on the barriers facing patients and caretakers, as well as resources available to them here in Middle Georgia.
It's really an alarming issue.
Dr. Nying Lee is an assistant professor at the University of Georgia College of Pharmacy. Lee conducted research about the drug lecanemab, which was approved in 2023 as a way of slowing down the impact of Alzheimer's disease by decreasing amyloid protein buildup in the brain.
In order to be eligible for the drug, you need to get a diagnosis that you have early stage Alzheimer's disease, and it only applies to early stage, so this window of eligibility is very critical.
That presents a challenge for rural Georgians, as no rural counties have a PET scan facility used to diagnose Alzheimer's. And the challenges don't end there.
A lot of the rural counties, they are also lacking primary care physicians, which is the entry point into referral into the healthcare system.
Lee says there are 28 lecanemab infusion centers across Georgia, but most are clustered around Metro Atlanta and only one in a rural county. Some Middle Georgians have to travel more than an hour before reaching the doors here at Macon's Memory Assessment Clinic. That's why the Middle Georgia Regional Commission Area Agency on Aging works to fill in the gaps. Mott Smith says she's often connected with patients following their diagnosis at the Memory Assessment Clinic, helping those who wish to stay at home through programs like Meals on Wheels. She says the Area Agency on Aging also works to ease the burden on caretakers by providing education.
How to get better sleep, how to rest, what meals to cook, what other agencies locally can help them.
Smith says the hurdles for patients living with Alzheimer's disease and the other two forms of dementia can be daunting, which is why she encourages families not to try to tackle it alone.
Out there in the small towns, there are resources for them, and we help them find those resources. And so the caregivers are very happy with what we have to offer.
In Macon, Taylor Gilchrist, 41 NBC News.
Dr. Lee says the opening of the new University of Georgia School of Medicine will work to decrease the statewide physician shortage in the coming years. In the short term, she encourages those in rural areas to take advantage of telehealth services.